Fox News alert now, the Ebola emergency here in America.
The killer virus
spreading much faster than efforts to contain it.
Spiraling out of control.
Stop admitting West Africans into America right now.
Can they go to the movies?
Hospitals aren't ready.
Hell is about to break loose.
The Ebola virus disease, otherwise known as EVD, causes an illness that is often deadly if it is not treated immediately. Ebola appeared for the first time in 1976, where two concurrent outbreaks occurred, one in Nzara in Sudan and the other in Yambuju in the Democratic Republic of... The outbreak that is currently taking place is in West Africa. The first reported cases were in March 2014. More deaths and cases being reported in West Africa are larger than they have ever been. This outbreak is larger than all others combined. But how is Ebola transmitted? The common consensus is that fruit bats of the Terpotopidae family are the natural hosts of EVD. Human beings are prone to catching the disease if they come to contact with infected animals. Ebola spreads from one person to another through direct contact, such as sharing beds, clothes, or the obvious secretions. Healthcare workers, on the other hand, have frequently caught Ebola due to case mismanagement, whilst funeral orations can also transmit disease via the body of the deceased person. In short, people remain infectious as long as their body fluid contains the virus. Men who have fully recovered can also transmit the disease through their semen for up to 7 weeks after the recovery. The symptoms and diagnosis of Ebola. The incubation period between the infection and the beginning of the symptoms is 2 to 21 days. The very first symptoms are the unexpected beginning of fever fatigue, sore throat, muscle pain, and headaches. The early stages of symptoms are then followed by advanced stages. These stages include vomiting, diarrhea, both internal and external bleeding, impaired liver and kidney function, and of course, rash. The diagnosis of EVD can be difficult to distinguish from other diseases such as malaria and typhoid fever. Within a few days after the beginning of the symptoms, patients are required to take tests, which include IgM ELISA, polymerase chain reaction, virus isolation by cell culture, antigen capture detection tests, and electron microscopy, amongst others. Later in the disease or after recovery, the patient is required to do one test, which is a test for antibodies by the name of IgG. Can Ebola be treated? There are 3 tests retrospectively deceased patients should take, and they include PCR, virus isolation, and immunohistochemistry testing. The only treatment available now is care rehydration with intravenous or oral fluids, and the early treatment of certain symptoms can also help survival. There are no vaccines available yet for Ebola. However, 2 vaccines are now undergoing human safety testing. Blood products, immune therapies, and drug therapies are also being evaluated. But how can Ebola be prevented and controlled? Firstly, in order to prevent the disease, then human to wildlife contact should be limited. Animals should be handled with gloves, and raw meat should be cooked before eating. Secondly, limiting the direct contact with the patients must reduce human-to-human transmissions. This can be achieved by using the right apparel, such as gloves and protection when dealing with the patient. Regular hand washing is also recommended. Thirdly, the deceased must be buried as soon as possible in a safe manner. In addition to safe burial, the infected should be separated from those who aren't infected. But to what extent can we classify the current Ebola outbreak as an epidemic that will endanger the lives of millions? First of all, we have to define what epidemic means. According to the Oxford Dictionary, a sudden outbreak of an infectious disease that spreads rapidly through the population, affecting the large proportion of people, is an epidemic. And judging by the chart provided by the WHO, which describes the rate of spread of the infection, one can conclude that Ebola is rising exponentially. Thus, it could be categorized as an epidemic. But this data must be put into perspective, and other facts must be considered. According to the article Controlling Ebola Next Steps, published in the Lancet academic journal, Ebola is not an epidemic for the following reasons. One of the most important reasons is the current outbreak is limited to certain countries in Africa. These countries housed previous outbreaks and have mediocre healthcare systems. The previous chart reflects a rise in the number of patients due to the efforts conducted by the WHO concerning the identification and localization of infected individuals. As citizens of these countries are afraid of foreign doctors due to recent political events, they hide their infected, thus creating false data. In the map above, it places the current infected patients of Ebola in Europe and the United States. It highlights that the infection is minimal, and that the usage of early detection, isolation, tracking, and treatment of the virus conducted by these countries is the best way to limit the spread of Ebola, thus not becoming an epidemic. In fact, the epidemic nature of Ebola is a fraud being spread by false interpretation of the data, hence this using the scientific thinking method is not widely adopted, and that the media is magnifying the situation. Containment of the outbreak using the previously stated methods will help contain the outbreak and not let it transform into an epidemic.